Okay, let's move on then and to Mark. And let's see, the World Health Organization G20 meeting.
Yes, here he is again, the Director General, Tedros Ghebreyesus, peddling his policy changes and he addressed the G20. Here's the headline from the WHO itself. WHO Director General's opening remarks at G20 Health Ministers meeting, inaugural session just very recently, the 18th of August. From there,
keep going.
This is some of what he had to say. This kind of lays the groundwork. I thank India for its generous hospitality and for its visionary leadership by making a priority of its G20 presidency. So India is leading the pack this time. I also congratulate India for its commitment to universal health coverage at home. They're really pushing this for the poorer countries, by the way, through the WHO, especially through Mr. Bharat. I won't try to say that first name, the world's largest health insurance scheme. On Wednesday, I had the opportunity to visit a health and wellness center here in Gujarat, which is providing primary services in households. I was especially impressed by the use of telemedicine to provide consultations. Of course, that's where doctors and patients communicate online and they don't have to get together in person. That's not such a bad thing in and of itself, of course. This is just one example of how digital technologies are transforming health locally and globally. Did you have something to say, Mike, before I go on?
No, only to say, of course, that's exactly what we're seeing in this country, fewer and fewer face-to-face meetings with general practitioners and more online or telephone, teleconference type meetings with GPs, and people are not getting a good service as a result. But go ahead, Mark.
Yeah, it can be a convenience. It can be useful, but you're right. If you have something more in depth wrong with you, it can be very substantive. But moving on from there, the Director General had this to say during his address. I thank India and all G20 countries for your leadership in developing, get this, the global initiative on digital health, which we will formally launch tomorrow. And tomorrow was this past Saturday, August 19th. So the global initiative on digital health, and I don't know if a lot of us saw that coming, at least not long term, and that's been launched. And moving on, Mr. Gates also noted the following: this supports the WHO global strategy on digital health and will amplify other initiatives, including the WHO Global Health Certification Network, which we established earlier this year with European Commission support, no less. And that involves digital technologies which have a proven potential, the DG claims, for delivering health services to marginalized groups, for preventing and responding to health emergencies such as COVID-19. So one detects that they're adjusting the dials here with all these digital initiatives and related matters, while the WHO also talks about supposedly increased COVID-19 cases as the winter approaches, and they're working pandemic treaty and the international health regulations that we cover regularly here. So it appears by all indications that they're putting all the chessmen, all the pieces in place to move forward, possibly with claiming another pandemic, but certainly it provides grist for the mill for the treaty and tightening up those regs. And the digital indications there, or the digital project, could also indicate more work on digital IDs to prove you've been vaccinated. That would certainly fit into that scheme. But this is just more steps the WHO is taking as we watch them step by step over the course of this fall, going into early next year, and then next spring when they plan to wrap up that pandemic treaty. So that's just the latest update, Mike.
Okay, thank you, Mark. Now we're going to come on to quite a bit more this time from the Russians on this issue of pandemics and so on. But David, in the chat box just before the program started, somebody was saying that their father is in hospital at the moment, has been put on a COVID ward, and that they are expected to wear a mask as they would visit their father. So, do you really think, and just the headlines in the Mail over the last, particularly the Daily Mail over the last few days, talking about this new scary variant that we've got to be concerned about, and that we might see a mask mandate coming back this winter. Do you think they're really going to try to play that gag again?
Well, I wouldn't have thought so, because the arguments had failed and the arguments were shown to be false. And since they don't have justification, they're going to run into a lot more resistance and a lot more legal challenges if they were to try it a second time around. But are they that stupid? Well, it could be. We've got Jason Leach up in Scotland, who is bigging up the fear already and talking about 200 cases in hospital and suggesting that we're going to have a very difficult COVID winter.